Hi, my name's Karen Greenhalgh, and this is the next video in the series on my journey with cervical cancer. And if you've been watching, you know I was diagnosed in November of last year with cervical cancer, and I've done a few videos explaining how it was diagnosed and the tests that I had to go through and that kind of thing. And I finally had surgery on April 10th, last Friday. And I do have notes this time. I don't normally, but I have a lot to cover that I want you to know. The whole idea of these videos is to give women and the people who support them information, and hopefully some information and encouragement that will help them to get through this journey that I found myself on. So first, the surgery, I was told I would have a robotic surgery. So I was thinking, I've heard of laparoscopic surgery where the doctors will do a couple of incisions and they can put tools in, and that's what I was expecting. But it turns out what I had was a real robotic surgery, and it's called the Da Vinci. I love the name. So it's like creating a new me. I'm going to put a video in the link below, and so that y'all can look it up. I found a really short video where you can see how it worked and what it does without being overwhelming. And I never got to see it. I didn't see it until I found that I started trying to find a video for you guys. And it's virtually an entire little room. And the Da Vinci has 5 robotic arms that went into my abdominal area through 5 incisions that were about 1 inch to 1.5 inches long. And the nurses taped padding on my back. And that's the first time that I thought, this is kind of strange. So the nurses put padding on my back when they were getting me ready to go under. And I said, why are you taping padding on my back? And they said, because his bed is very hard on your back. And I remember thinking, his bed, my surgeon's a woman. And that's the last I remember until I woke up, a few hours later, and was told the surgery had been successful. So where the incisions go in, they put like glue over it. It's not tape, it's not stitches. It's really like super glue. And there's some bruising there. But there's also a lot of bruising on my sides. I have a bruise, you can't tell, but I have a bruise like 3.5, 4 inches wide running around both sides of my waist, probably to where the padding was. And I'm thinking that was strapping me and holding me in place for the robot to work. You gotta watch the video. So the surgery went without complications. It was a total hysterectomy, which means my uterus, my cervix, my fallopian tubes, and my ovaries. They basically took everything they could, and since we don't know how extensive the cancer is, and hopefully it's not that extensive. So I don't want to get off on that tangent, but I have a follow-up appointment with my surgeon on April 23rd, and hopefully by then she'll have the results. I hope so. Because all of those body parts had to be shipped off to pathology to be analyzed. Oh, my doctor, if you looked at the other videos, you know that I had the same OBGYN for 40 years. And he's the one that always monitors every year. And he's the one that found this when it occurred in 2018 at my regular annual exam. And he's the one that fought to help me find a surgeon to do the surgery for me in spite of my bleeding disorder. He called me just a couple of days before the surgery just to wish me well. And I will see him again. So the bleeding disorder that caused so much trouble, I have von Willebrand's factor disorder. It's a genetic disease. It's a genetic condition. And I found it when my sister was diagnosed in the early 2010, 2011. And she was diagnosed, and so I had myself checked, and sure enough, I had it, which explained some unusual bleeding instances I'd had throughout my life, but they hadn't even heard of von Willebrand's yet. My mom had it, her sister had it, my niece and my niece's daughter. So it's genetic. It runs mostly through women. And what it means is there is a factor in your blood that makes your blood know when to clot, and how much. And if the factor is low, it doesn't start clotting as soon as it would otherwise, which is why sometimes it's a problem and sometimes it's not. With surgery, it's a big problem. So going into surgery, they did what they call an infusion. It's an infusion directly into my blood. They didn't take anything out, they put stuff in. And the nurses in the hospital, they had to do this before the surgery, after the surgery, 12 hours after the surgery, and then 12 hours later again the next day. And it was really interesting. I've already gone over time. It was really interesting to watch them because even though they had done infusions, I didn't misspeak on my post last week. They had done infusions. They'd never done my medicine. And the medicine comes in 2 vials. They're refrigerated. They have to stay in the refrigerator until they're ready to give it to me. And they come in 2 vials, and the tops are made special so you can screw them together. And then you have to swirl them, not shake, but swirl them until they're combined. And how much they had to give me, they were pulling out calculators because it's all based on my weight and stuff. But every time they did it, that I was awake at least, there were 3 nurses, and one would check a step and give it to the next one, and she would calculate that step and give it to the next one, and she would calculate that step, and then they'd compare notes. And they were really excited to get to do something they'd never done. They had done infusions, but not my medicine, which is so rarely called for. Then after the surgery, I had to go back Tuesday morning and Monday morning and Wednesday morning. And I got infusions at my hematologist's office. And that's a different medication. What they gave me in the hospital was a von Willebrand's replacement. They put that in my blood. It was there, ready to go when they needed it, which was when they did the surgery. And then when I got out, they were giving me a different kind of medicine that stimulates my body to release von Willebrand's, because that's the problem. If your factor's low, it doesn't release quickly enough. So they were giving me a different infusion in the hematologist's office. So I know that sounds like a lot. I got everything I had in my notes, but I am well. It's been a long week, a very, very, very long week. And I really look forward to the next video where I'm going to explain what it was like recovering. Some of the advice, some of the doctor's advice, I'm a stickler for following orders, but it wasn't as clear as it needed to be. So things as far as exercising, I even found out about pillows. I have a special pillow I want to show you. Diet, there were a lot of things that I wasn't told that I can tell you. And so this is the longest video I've done yet. So I feel like I need to just hurry up and get off, but I'm up and I'm good. And thank you so much for listening. And if you go to my church, I will see you Monday. I will see you Sunday morning. If you go to my church, I will see you Sunday morning. And that's just going to be so nice. And God's been very good. And I feel very blessed to just be here and talk to you guys. Oh God, I wasn't going to do this. So anyway, thank you all. Thank you all so much for, oh my gosh, all of the messages of support that I got. And people who know me and don't know me, I want you to hear this, that I'm here, I'm good, I did well, and I'm going to share all the details with you. So if you're on this road, or if you're helping a woman who is, maybe you won't make the same misjudgments I did. I overdid, but at any rate, so thank you so much.